Right. A very good evening. So I think we are all aware of a very recent update we got that. So I think we are all aware of a very recent update we got that. A very good evening, guys. Welcome to the platform of Unacademy. So now I'm going to discuss some high yielding MCQs now. In this session, it's going to be a short session, so where we'll be discussing few MCQs. Before I start with the MCQs, I think you're all aware now that all the exams, all the central exams have been merged into one. That's your AIMS, Delhi, AIMS, Peripheries, PGI, JIPMA. Now, whether it's a good news or a bad news, I think it's a good news because the opportunity for us, the seats, the number of seats are definitely increasing, and the possibility of us going into one of the central institute, it also increases. So I think it's a very good opportunity, and the wasting of the seats or the blocking of seats won't be there, because obviously if they're choosing AIMS, they're leaving PGI, right? So I think it will be more better for us, and I want you to give a very strong preparation so that you get into some of the central institute. So it's a best opportunity. So before something else comes out like next or anything, I think take this solid advantage and enter into any of the central institutes. So today we actually had NIMHANS exam. I could get only one question from some student who has sent me the. I had one question one of the student has sent. So I'll just write it here so that we can answer what was the NIMHANS question. So we had NIMHANS exam today, right? So just give me a minute. I'll just put forward what was the question which we got today. So there was one question on the latent phase of labor actually. So I had one student putting forward to me, but I'm not able to find. But yes, there was one question where they have put forward about the latent phase. There was something asked about the latent phase. It was a good and easy question, right? So I'll just tell you the question now. Primary gravida is in labor for past 14 hours, and cervix has dilated to 2 centimeters without any progress. What is the next line of management? What is next line of management? So in this question, they're asking what is the next line of management. A, immediate LSCS. B, oxytocin drip. C, wait and watch. D, epidural analgesia. Now, whenever you have a question pertaining to labor, my advice to you is always try to understand which phase of the labor is the patient is in. So, for example, in this question, the cervix is only 2 centimeters dilated. So, patient is in which stage of labor? Patient is in first stage of labor. And which phase of the first stage of labor? She is in latent phase of first stage of labor. The average duration of the first stage of labor, latent phase for a primary gravida is 10 to 12 hours. So definitely it has gone beyond, but when do we call prolonged latent phase? When it goes beyond 20 hours. So indeed, even if it crosses beyond 20 hours, I'm not going to do anything. I'll just wait and watch. So latent phase, any abnormality, the best thing is to just wait and watch. So the answer here will be C, wait and watch, right? So do you see, I kept this question to tell you that, so usually the questions are just based on whatever we are learning. So there's nothing new or whatever might be the framing of the question. If you understand the basic concept everywhere, I think any question you can answer, right? So we have done plenty of the questions on labor. So this is one example of latent phase prolonged. Okay. Very good. Excellent, Sana. You are correct. A HIV discordant couple desiring children are counseled regarding the risk of viral transmission. Which of the following information is correct? So discordant couple is where husband is positive and wife is negative. So there is a chance of husband transmitting the HIV to the wife. So what should you do? The only safe approach is sperm of a healthy match donor. The couple should defer pregnancy to avoid the risk of viral transmission. Semen washing and artificial insemination is a safe option for both male and female partner, both for female partner and offspring. Only IVF should be performed if the infected male partner's semen is to be used. Now, what do you think is an appropriate option here? So you don't require to defer the pregnancy. What we can do is we can do semen washing and do artificial insemination. So when we do semen washing, we remove all the kind of bacteria and viruses. We treat them against the HIV, HBS, AG, everything, and then we take the highly motile sperms and we infuse it into the uterine cavity. So we can do semen washing and artificial insemination, which will be safe for both for female partner and the offspring. Okay. Next, what type of drug is raloxifene? So we all know that raloxifene is a selective estrogen receptor modulator. How does this act on the endometrium, bone and breast? Agonist, or agonist, antagonist, antagonist. So which is the most appropriate answer of how is raloxifene acting on its receptors? So raloxifene can be used for osteoporosis. So it is agonist to bone. But the good thing is it is antagonist to endometrium and breast. It is antagonist to endometrium and breast. So C is the best answer which we have here. C is the best answer which we have here. So that's why raloxifene is also used in breast cancer. Tamoxifen is also another SERM which is used in breast cancer. But tamoxifen has the risk of endometrial cancer. But raloxifene does not have the risk of endometrial cancer. But one side effect of raloxifene is it causes venous thromboembolism. It causes venous thromboembolism. Okay. One more question. A 28-year-old amenorrheic woman who wishes to become pregnant attends the fertility clinic complaining of galactorrhea and mild visual disturbances. Her serum prolactin level was found to be elevated. MRI scan of the head is performed which shows presence of macroprolactinoma but without suprasellar extension. What is the most appropriate first line management? Now guys, what do you think this is? When you have a galactorrhea with visual disturbances. Excellent, Syed. You are very correct in answering bromocriptine. So this is a case of pituitary adenoma, but it is having visual disturbances but has not got suprasellar extension. So the drug of choice for pituitary adenoma in pregnancy or in patients who are infertile is bromocriptine. Whereas all other cases we go for cabergoline, but in pregnancy and when they have infertility, we have to go for cabergoline. Pregnancy and infertility, it is bromocriptine, whereas cabergoline is beneficial for non-gynecological patients or those who are not bothered about the pregnancy or infertility. For them, the first line is cabergoline. But they want to get pregnant or they are infertile, then your first line is bromocriptine. Yes, the drug of choice overall for pituitary adenoma is cabergoline, except for infertility and pregnancy. Okay. Following a spontaneous miscarriage at 8 weeks of gestation, a woman is referred to gynecology clinic with persistent irregular vaginal bleeding. What initial investigation should be performed? Post miscarriage or post pregnancy, if you have irregular vaginal bleeding persisting, you should always rule out choriocarcinoma. You should always rule out choriocarcinoma. Normally, beta HCG will become nil after 1 to 2 weeks of abortion. It becomes nil after 1 to 2 weeks of abortion, and it becomes nil after 6 weeks of full-term delivery. Okay. So now here there is a persistent irregular vaginal bleeding in spite of the even after the miscarriage. So I want to rule out choriocarcinoma. So first I'll do UPT. If UPT is positive, then probably I'll do serial beta HCG monitoring. So if UPT is positive, then you will do the serial beta HCG monitoring, right? See guys, now point number 1 in this question, this was a choriocarcinoma. This I am ruling out choriocarcinoma because she is having persistent irregular bleeding. Now you might ask, why are we not going to serum beta HCG level? Why are we going to UPT? They have asked us what is the initial investigation. They asked us what is the initial investigation. So initial investigation will be UPT. If UPT is positive, then I'll go for serum beta HCG, because serum beta HCG is more costly compared to UPT. UPT is hardly available everywhere, right? The kits are available everywhere. So 70 rupees, she gets the kits, she can check it, right? Okay. So as I told you, this is a very short session, so the last question for today. A 30-year-old woman attends the gynecology clinic with discomfort in the left iliac fossa. Clinical examination suggests a pelvic mass. Ultrasound scan is arranged, which demonstrates a simple cyst in the left ovary with diameter of 45 mm. The right ovary and uterus appear normal. What other investigation is required? Alpha fetoprotein, CA125, beta HCG, no investigation required. So this is based on our, as she is 30 years, I'm not suspecting this can be an epithelial ovarian cancer. Epithelial ovarian cancers are usually seen beyond 45 years, around 60 years age group. So I'm not suspecting epithelial ovarian cancer, so I'm not going to do CA125. If it's an elderly woman, then CA125 must. But she is 30 years, so I'm not suspecting epithelial ovarian cancer, so no CA125. When you have a reproductive woman or premenopausal woman coming to you with adnexal mass, if the size of the mass, or the adnexal mass is nothing but the ovarian cyst, if the size of the cyst is less than 5 centimeters, you can just do USG follow-up. Most of them resolve within 3 months. Mainly it is the follicular cyst. If size is between 5 to 7 centimeters, if it is a simple cyst, in the previous question it was a simple cyst, just follow up. Complex cyst, go for surgery. And if it is more than 7 centimeters, you have to go for surgery. So using this table, I am going to answer the question which I have just now kept. It's a 45 mm reproductive age group, so less than 5 centimeters. And you know the best thing which they told, it's a simple cyst also. So I don't require to do anything. I can just do follow up. So no investigation required. Right? So I hope you all understood this question. So that was a short and sweet session which I discussed 5 questions in a quick manner. So next month, there's a big announcement for the next month which I'm trying to do. So you all know that next is going to approach in a year. So there are many students who are preparing in the orientation of next. So in next you have a lot of importance for the practical clinical based discussions. So clinical based MCQs. So more like OSCE, clinical based MCQs and clinical based discussion, where more of clinical approach to your cases is what we are going to see than your single liners or anything. So I'm going to do series probably weekly one session on the YouTube where I'll be discussing the clinical based questions or clinical based discussion on case scenarios. So that will be a weekly one session which I'm going to do. Okay. And on Unacademy Learning app, yes, I've already done every month from the lockdown has begun. I've done many of the free classes. So on Unacademy Learning app, I'll be doing the free MCQ series. This month I've done topic wise. So next month I'll be doing mixed bag. So probably every day we'll discuss around 20 to 30 questions on the learning app, accessible to everyone. So that you will have the touch with the obstetrics and you don't forget obstetrics. And it's a good, so all of you should be well oriented and give your best for the single central exams. So don't be disappointed, it's a positive thing. We have more chance of getting into any of the central institutes. So work hard and all the best, keep studying. Any queries, always you can ask me. I'm Ramyasree. So I have a query here from Paras. Which institute is better? Now, perhaps all institutes, every educator works hard enough so that they give you the best. So it depends on wherever you are feeling comfortable, which you are able to understand better, which is giving you the 100%. Probably I might understand some people, I might not understand the others. So which is comfortable to you, you have to notice that. And once you decide, so you have free classes with everyone. Take some free classes, you will be able to understand which one you want to go with. And once you decide which one you want to go with, stick to that. Don't jump and do biryani of multiple platforms. Stick to one platform, stick to one thing, so that will give you a better fruit. Okay. Thank you guys. All the best. Keep studying.